Yeah, shut up.
Hello.
Just kidding. Oh, wait, yeah, we are.
This is my Cat 3 video for SOT. This is Justin Merriman. He was so kind to help me on a Friday afternoon. Favorite thing to do. This is our prone leg length analysis to start a Cat 3. I'm going to ask the patient to push out in my hands. 1, 2, 3, and relax. And we have a high left medial malleolus. So this will be our short leg on the left here. And this is going to drive our Cat 3 and how we block. Cat 3 is all to do with a disc problem. So next we're going to go into the glute fiber analysis. And we're going to start at the ASIS. And we're going to go 5, 4, 3, 2, 1. Each correlates with a lumbar vertebra. So like I said, so we're just going to feel bilaterally for tenderness. Start at the ASIS, 5, 4, 3, 2, 1, and we can go even to T11 or T12 and T11, and we're just feeling for tenderness, and we're going to go around the iliac crest and all that. If tender after we block for Cat 3, we're going to treat that as a trigger point. Also, indicators we're going to use are the glute, hamstring, and calf, and also the temporal sphenoidal line. And all of these we're going to check as we block for Cat 3 to see how the patient is reacting to such. Next we're going to do the step out to out, the SOTO technique, which is therapeutic as well as diagnostic. So we're going to treat, we'll say Justin has a right sciatic leg, and we're going to take out the leg about 12 to 14 inches until the glute fibers bunch up, and we're going to be superior to the knee, and then we're just going to rotate his toe out. And we're going to do that for about 10 to 15 seconds, and then just return the leg back to neutral. We're going to wait about 2 minutes and then repeat that, and then we're going to ask the patient after that 2 minutes, is it better, is it worse, is it the same? And from there, if it was better, we're going to indicate it as a piriformis problem. If it's worse, it's going to be a sequestered disc. And if it's the same, it possibly would be just subluxation or herniated disc. If it was a piriformis project, or if it was a piriformis problem, we could repeat every 2 minutes until the problem gets better. Next, we're going to do Cat 3 blocking. Patient's going to be prone. We're going to have the SOT board 4 inches above the iliac crest. Also, we can have the sternal roll in place. Also, this is passive blocking. It is important that the patient does not help. So we're going to use shoes as our makeshift SOT blocks. And at the trochanter on the short leg, his left short leg, we're going to passively rotate, and at the trochanter, angle that down. And walk over to the non-sciatic leg. And at the ASIS, it's also going to be pointed 45 degrees inferiorly. Our goal here is a reduction of pain. In Cat 3, that is what we're going after. And then maximum blocking time for Category 3 is longer than any of the other categories. It is 30 minutes. Next, we're going to do block augmentation, which is first and foremost is posterior iliofemoral ligament. So as long as we have the patient blocked in Cat 3, I'm going to look for a restriction with the iliofemoral ligament, and I'm going to rotate the legs internally, looking for restriction. And on his right, he's got quite a bit of restriction, so I'm going to go to that side of restriction, and I'm going to contact the posterior iliofemoral ligament, which is about 1 inch posterior and superior to the acetabulum. And then I'm just going to shoot through the opposite obturator foramen, double thumb contact, just like that. And then I'd recheck to see if it was any better. And it's better. Next, we're going to do lumbar vertebral derotation. So, patient is still blocked in Cat 3. I'm going to ask the patient to go ahead and grab onto the head of the table. And I'm going to flex the patient's knee on the sciatic leg towards the glute. And I'm just going to check the lumbars in here. So say we have an L4 problem. So L4 rotation. And I'm just going to push towards the side of correction as I flex the leg forward. And also lumbar rotation may be linked to a cervical indicator as well, so we can find this that way as well. So we're just going to treat it, like I said, push the spinous into the side of rotation where it should be as I flex the leg forward. Okay. Next is going to be lumbar inferiority lift. Like I said, patient is still blocked in cat 3. Patient continues to grab hold to the head of the table, and I flex the knee with the inferior hand on the end. I'm gonna have to splice here.
Okay.
This is like I contact spinous itis.
That's is manual activity inside of there. This is like one side.
Side of the open wedge. Okay. Okay, so on this one, this is going to be like the lumbar is tilted. And so I'm just going to push the mammillary I to S at this point as I'm flexing the leg towards the glute. Just continue to do that. And then these continue to correlate with cervical indicators as well. They're the Levitt Brothers principles. Next is acetabular goading. Patient's properly blocked for cat 3. And I'm going to flex the patient's knee towards the involved side glute. And I'm just going to feel for acetabular restrictions as I internally and externally rotate the femur within the acetabulum. And I'm just going to find nodules and treat them in the position in which I find them. I can move the leg in small circles, maintaining pressure on the nodule to help strip it as well. Next is orthopedic blocking. And this is extremely simple. And all I'm going to do that, and the goal is that this is used to derotate a vertebra. So I'm going to pull the block on the spinous rotation or on the short leg side. This is continued to be in categories 3. So I'm just going to pull on the short leg side. Ask the patient if that's better or worse. Next is sciatic traction, and patient's still blocked category 3. The indicator here is sciatica, as opposed, so nerve pain down the leg. I'm going to traction as the patient grabs the head of the table, and I'm going to hold for about 5 to 10 seconds. And then I'm going to repeat until pain is gone or there is no further improvement. So, next we're going to do analysis and correction of the sacral base. And this is done through the same technique we used in one of the previous for Cat 1. I'm going to place my thumb on the L5 spinous, have the patient cough. Go ahead and cough in. And I'm going to observe which my thumb goes. If my thumb goes towards the ceiling, that's positive. If my thumb goes towards the head, that is sacral base negative. And if it goes up and over, sacral base neutral. So I'm going to pick one. Sacral base positive, for instance. Sacral base positive, I'm going to angle both of my blocks at the ASIS at 45 degrees to create a happy face. And from here, I'm going to ask the patient to breathe in. And during inhalation, I put pressure on the sacral apex, have the patient breathe out. Okay? Now, if my sacral base was negative, I would do 45 degrees up at the trochanter. So I'm going to do here. There you go. Just like that. I'm going to create a frowning face. So from here, I'm going to go sacral base during exhalation. So breathe in and out, and pressure on the sacral base. And then sacral base neutral, I would combine both of these techniques, but I would have my blocks in a perpendicular position towards the patient's body, and I would put pressure on the apex during inhalation and pressure on the base during exhalation. Next is all of my post-blocking techniques, and I'll ask Justin, go ahead and hop up for me and face the opposite wall. what I'm going to have him do is I'm going to have him put his chin on his chest. It's important that the patient has his chin on his chest the entire time. And so let's say it's an L4 disc issue. I'm going to apply I to S pressure and have the patient flex forward. And I'm going to apply P to A pressure as the patient leans forward. And I'm patient flex or extend. Make sure to keep his chin towards his chest. I'm going to continue that until I can reduce pain. Next is side posture. This is for sciatica. The indicator is sciatica. Patient is on the side of sciatic leg down. So let's say he has the left sciatic leg. We're going to have a patient in left side posture. And the rotated vertebra also must be, the rotation must be towards the sciatic leg. So sciatic leg down, spine is towards the sciatic leg. Here, we're going to do a kick maneuver. Superior hand on the patient's shoulder, tractioning up. And then I'm just going to apply I to S pressure and P to A for inferiority. And that's my Cat 3 video. Thank you.